has affected the heart. Now, we stopped on the management of diabetes mellitus on that Sunday. We mentioned that diabetes mellitus can be treated basically in two different ways. Either you are using drugs to treat the diabetes, or you are not using drugs. You are just trying to adhere to some lifestyle changes. That is the non-pharmacological means of managing or treating diabetes. We discussed the non-pharmacological methods, and we said that the pharmacological methods will be discussed today. Some of the non-pharmacological methods that we mentioned are washing our weights, that weight reduction, alcohol reduction or alcohol cessation, smoking cessation, that is stop smoking, exercise, healthy living, avoiding stress or reducing stress, drinking enough water, like about 3 liters of water every day, taking stroll, walking, brisk walking, jogging, or some little exercise that the body can tolerate for 30 minutes, 5 times a week. We should make it a habit like that. We also mentioned diets, that we should watch the amount of carbohydrates we take in. If we take less carbohydrate, that means we'll reduce the stress of the work that the pancreas will do. So if we take less carbohydrates, we will not have much of challenges with taking care of the glucose in the body. Now we are moving to the pharmacological methods, which means use of drugs to treat the diabetes mellitus. Now, this pharmacological method can be use of tablets. Those are the medication tablets, or it can be by the use of injection, insulin. We mentioned insulin the last time, that insulin is produced by a certain organ in the body, the pancreas, which will help us to make use of glucose to release energy to the body. So those people that have type 1, I said they have insulin deficiency. Their pancreas is not producing enough insulin. So such people, it is insulin that we are going to use to treat them. The other set of people, the type 2, their own pancreas is still producing insulin. However, the body is not recognizing the insulin. So you can give some medications that will help the body to recognize the insulin and make use of the insulin to work on the glucose in order to release energy. They also can work by stimulating the pancreas to secrete more insulin in the body. Another way they can work is by reducing the breakdown of carbohydrates into glucose, so as to reduce the excessive amount of glucose in the blood. Another way they can also work is by preventing the liver from producing glucose, because the liver too can produce glucose. So they will not prevent, or they will slow down the release of glucose from the liver. These are the ways these tablets can work. The tablets are in different classes. I don't want to bore us with the names, because you'll just be wondering. Some are called sulfonylureas. We have examples of them. The biguanides, example of them is the metformin. People that have diabetes, they will know metformin. Metformin is also called glucophage. We also have some other groups like that. The alpha-glucosidase inhibitors and some other big names like that. I don't want to bother us with those names. So we are leaving the medications now. We are going to the insulin. I told you that type 1, we need insulin. Type 2, we need basically the tablets, which we have mentioned. However, a time will come when people that have type 2 will also require insulin. They will just notice that their tablets are not working again. It may be that, like I said, the tablets, some of the way they work is to stimulate the pancreas to produce insulin. It's just like you are sucking juice from the orange. The orange is taken, for example, as the pancreas, as the organ, and the juice from the orange is the insulin that is coming out to work on the glucose. So this tablet, for example, will be squeezing the orange, will be squeezing the pancreas to release the juice, which is the insulin. So a time will come after squeezing, there may not be enough juice, just like when we take orange. A time will come when the orange is dry, no more juice coming out. So in that situation now, if you keep on giving the tablet, the tablet will just be squeezing the pancreas, no insulin will come out. So that is why at that point, people that have been on tablet before, the type 2 diabetes patient that have been on tablet, we now require you to supplement, to support them with injection of insulin. Since their body cannot squeeze out, cannot produce the insulin again, you now have to bring insulin from outside in form of injection and give them. So this insulin, there are different types of this insulin. The ones that act very fast immediately. When you give the insulin now, within 15 minutes, it should start working on the body. These ones are basically used when we have emergencies, because we see patients, they come to the hospital with very high glucose in the body. So what we usually do firstly is to give them this fast-acting, we call it rapid-acting insulin, to give them, just to bring the sugar down. We also give them some other form of treatment, like giving them fluid, because they need water. We suggested that we should drink enough water well. So we give them fluid, water, normal saline. We rush it into their body just to help dilute or to help them also pass out the excessive glucose in the urine. So the first type is the rapid-acting insulin. We have another type, short-acting insulin. This one, they don't act as fast as the other one. They act within like 30 minutes, and their effects can last up to like 2 to 4 hours. 2 to 4 hours, 3 to 6 hours in the body. Then the intermediate ones, they last longer than this short-acting. They last up to like 12 hours in the body. While the last group, the long-acting one, they can last up to 18 hours, almost a day in the body. That's how their effect can be in the body. So these categories are used according to the need of the patient. So how do we administer